Marcroft.
Thank you, Madam Speaker. Very proud to be able to stand on behalf of New Zealand First in support of the Pai Ora Healthy Futures, Improving Mental Health Outcomes Amendment Bill, and I'd like to begin my contribution in the third reading to congratulate Katie Nimmin for bringing through this bill, shepherding it and providing what you mentioned in your speech, hope for change, because this is what fundamentally this bill will do. Mental health, Madam Speaker, is at the core of every person, and looking around this chamber today, who could disagree with that? There are ever-increasing ways that our mental health is impacted. And I'd just like to point out particularly, and the member opposite, Huhana Linden, talked about our young people. Our young people and the way their mental health is impacted is something that we should all take very seriously, and I'd like to point to a couple of things. Social media has a devastating impact on some of our young people. It should be a tool to bring people together, it should be a tool to bring communities together, but there are so many negative impacts on mental health because of the use of social media, increasing rates of depression, anxiety, and the bullying that goes on. These are some of the things our young people tell us, and that is really affecting their mental health. Also, that constant exposure to these curated lifestyles, where we look at someone on Facebook maybe, and we wish we had their life because it seems so ideally perfect. And the anxiety that creates, that dissatisfaction in oneself, and that sort of increases that low self-esteem. Those are issues that our young people tell us about. So social media, it should be that tool that brings together, but what we need to do is we need to build resilient minds in our young people. We need to help set boundaries, help them set their own boundaries, and sometimes just turn off the socials. In terms of mental health, Madam Speaker, many diagnoses come down to the question of whether the patient is distressed and unable to function normally. Most of us will probably fit that description, that definition at some point in time. Hopefully, not all of us, all at the same time. But when we're in our right minds, which I believe we are in the House today, is that we can re-examine our thinking about how best to care for and restore people to functional mental health. And so in conclusion, Madam Speaker, creating a mental health and wellbeing strategy is a very good start. I commend the bill to the House.